This is Dr. Jerry Hesch at Hesch Institute in Aurora, Colorado. I have a home-based office. I do research, I do writing, I do teaching, online courses, and some in-person courses. I treat the person and I treat the whole body. And this is my client who's seen me for severe sciatica. However, we're just going to talk about the upper neck. So I treated her atlas. And after that, I then treated, so that would be the atlantoaxial joint, which is the first and second vertebrae in the neck. But after that, I treated the occipito-atlantal, where the head and the neck connect, that joint. And I've developed some unique testing for both of those joints, and I've developed unique treatment as well. I'm going to ask the client to just give me some feedback about how she feels after treating those two joints.
I feel like my head is actually above my shoulders.
A little bit louder.
Because I tend to kind of like, I think because of working on a computer and phones, I kind of stoop forward.
Okay.
And I find myself oftentimes like hollowed this way right now. And it's very uncomfortable for me to sit up straight.
Okay.
Generally, but right now I feel really good. Like my center of gravity feels like a little further back than usual without causing me any pain like it usually would. And this is the way I'm sitting right now feels like natural to me, which is probably the best posture.
So your posture feels nasty?
Yeah, my posture feels like I'm not trying to sit like
posture is an output of the nervous system.
Yeah, like I'm not trying to do this. It's just how I'm sitting.
And
it's very interesting.
Your nervous system was very much involved in the upper two joints.
Yeah, and I feel like I'm taller.
Nice.
And I feel like my vision is wider.
Yeah.
So that's a really interesting.
And I do have other videos that if the person watching this wants to explore them, you could just type in my last name, Hesch, H-E-S-C-H, H-E-S like Sam, C-H, occipito-atlantal, and you could also search atlantoaxial joint. And I'll be posting some more videos soon on the new way I have of testing the OA joint. These are real subtle mobility impairments, right? Can you elaborate on that a little bit?
Yeah, I mean, it's like a 2-minute hold that's not uncomfortable in any way.
For the correction.
For the correction, yeah. And actually, I was in a car accident maybe 6 years ago, and I've always had a restriction looking over my left shoulder, and I don't have that restriction right now.
Nice.
Which is really cool.
Nice. And I treat those joints more with traction, with your head in a specific position, not with rotation. I mean, most clinicians treat the rotation of the atlas, and yes, it does rotate, but it also has a very unique up and forward and down and back movements. But it even gets a little bit weirder because the dens, this thumb-like projection, is shaped like a thumb, and so in one moment it's gliding forward, and then it glides backwards, and then it does the reverse of that. I'm not going to get into that complicated biomechanics, but it's a very interesting joint, and I think needs to be handled with kid gloves. And so the amount of force that I used on her head was certainly even less than the weight of the head.
Yeah, it didn't feel like a lot, but right now I feel like a big change in where my neck feels longer.
Beautiful.
And I feel taller.
Yeah. And once again, posture is not something you have to fight with exercise to change or with lots of stretching or lots of body work. It's an output of the nervous system. So if you evaluate the individual person and you find out what micro motion impairments they have, yours happen to be in the upper two joints in your neck, head and neck. And then you restore that micro motion, the body, I'm going to say, it realigns itself.
Yeah.
And good posture should be effortless, not something you consciously control.
Yeah, because that never works. You always
it doesn't work.
Yeah,
it doesn't work.
I've been battling
months later. Months
years.
later, I'm still doing the posture thing. I'm not doing enough. No, that's not it. Anyway, I'll stop yammering here. But at this point, I'm going to teach you how to just make sure these movements stay.
Okay.
If it should ever recur, you're going to know how to treat it if it's the very same pattern.
Okay.
But honestly, I don't think this is going to come back. I think
Okay.
this is a one-time correction.
I love a one-time correction.
Yeah, the body likes correction if it's done correctly.
My body really likes what's going on right now.
Nice, nice. Well, thank you so much.
Yeah, you're welcome.